subjects to discuss is mild IVF, and I get loads of questions from you guys about this because it's something I'm a big fan of. It's the sort of IVF that I practice and I'm a big believer in. And I want you all to understand what this is all about because I think there is some general confusion out there and some myths that circulate as well, which are that mild IVF isn't necessarily as effective as conventional IVF. And what I want to show you is that actually that absolutely isn't the case. And in fact, a lot more people are now converting round towards using milder techniques and stimulation. So the first thing to discuss is, why should we look to do mild IVF? What's the point of it? Well, I think it's really important to consider the health not just of the potential mother, but also the child. And any drug that you put inside of your body has some side effects. But in particular, when you're talking about IVF drugs, which are quite potent and which encourage the growth of any follicles that you might have on your ovaries. They encourage these follicles to produce eggs, but also they increase the amount of hormones that are circulating in your body quite significantly. And so all of these things can absolutely have quite drastic side effects. So the most common ones that women experience if they're going through IVF are bloating, perhaps some abdominal pain that's associated with that, nausea, headaches, tiredness. But this isn't ideal for any woman, especially women who are continuing to work during their treatment and who need to be able to provide and support themselves through it. So it's really important that we try and minimize the risk of any of these side effects on your other organs. And in particular, the one that is the most dangerous of them all, which is the ovarian hyperstimulation. So this is where your ovaries can end up being overstimulated by the drugs that you're receiving and produce substances that are circulated in the blood that can start to have some harmful effects and consequences. With severe OHSS, women can end up in hospital on treatment for a long period of time, and if they've had a transfer or are pregnant, can potentially end up having to terminate their pregnancies, which is something that no one wants. So it's really important that we consider the actual effects that these drugs are having on women's health. But even more than that, we're now seeing some studies which are suggesting that the drugs that we use to stimulate ovaries could potentially be not only having negative effects on the quality of the eggs that are being produced, but also potentially leading to certain gene programming through the process of epigenetics, or what's called gene expression. We don't know enough about this yet, and this research is fairly new, but there are definite associations between high doses of IVF drugs and preterm deliveries of children, and also smaller for gestational age children, so children who are born smaller. And this is really important because ultimately that can impact on the long-term health of any children who are born. So already there are several reasons as to why we want to try and reduce the amount of drugs that a woman is taking for her IVF. And then, of course, there's the cost, because all of these drugs are expensive, and the more you take, or the greater the dose that you take, the more expensive it is. So how does mild IVF work? Well, mild IVF says that actually no woman necessarily needs to have high doses of drugs. And certainly if you're a younger woman with really good ovarian reserves, you don't need a large amount of follicle stimulating hormone because you've already got the reserves there and the follicles there. So you need a gentle amount of stimulation to try and produce an ideal number of eggs, which is anywhere between sort of 8 to 12, we estimate. Perhaps a few more than that, but you certainly don't want to overproduce the eggs because that can tip you into the OHSS. In older women who generally have lower reserves, well, this is where conventional IVF isn't necessarily effective. And that's because the ovary has a finite supply of these follicles. And by over-treating them, by giving unnecessary stimulation, what can happen is the amount of competition increases amongst these follicles for nutrition and blood supply. And so the quality of the eggs that can sometimes be produced at the end could be compromised as well. And this is what we typically see, that if we try and induce an older woman to overproduce more follicles and more eggs, then potentially a lot of these eggs, that we find at the end aren't capable of fertilization and aren't capable of producing good embryos in themselves. So mild IVF has a place for women who are younger and also women who are older who have reduced ovarian supply or reserve. So I'd encourage you to think about the sort of treatment that you're having. Sometimes we do need to use a longer drug protocols. So these are things like downregulation, for example, in patients who have endometriosis. And there are sometimes cases where we need to go outside of the mild IVF setting. But I would say that this is more rare, and in fact, most women would be suited to having a more natural means of IVF, in particular if they're keen to try and avoid any of the side effects associated with these drugs, or any of the side effects, longer term side effects on their health and their baby's health as well. So if you are interested in mild IVF as an option, I think it's really important to discuss that with your doctor and see if that's something that they're able to do for you.